Thank you, Mr. Curley. Ms. Black.
Thank you, Mr. Chairman, and I do sincerely appreciate the opportunity to participate in this hearing. And I thank you for your leadership on this issue. This is a very important issue in understanding the fraud, waste, and abuse in the Medicare program. I, as many of myself and all the colleagues that have spoken here, do have serious concerns about the future of Medicare, the program, and appreciate viewing some of the recommendations that have been made by the GAO that has been published in order for CMS to address some of these fundamental structural changes that are facing our growing system. I think it was my colleague, Mr. Roscombe, that made mention of $75 billion when I think about billions of dollars that potentially cannot be accounted for. It's a tremendous, tremendous amount of money. I certainly appreciate the good work that is done by both the GAO and the Inspector General as well. Just recently, I sent a letter to Ms. Tavender on this very topic to understand why CMS has not adopted two recommendations made by GAO to reduce improper payments issued by CMS. One of them goes back pretty far, and we still don't see that there's been a resolution on this. It goes back to a 2007 GAO recommendation that was a requirement for contractors to develop thresholds for unexplained increases in billing in order to implement the controls under an automated payment system. And prior to issuing these payments under a fee-for-service, thresholds have not been developed to explain unexpected increases in billing. And that seems to me to be one that just ought to jump out and ought to be one that takes priority to say, why is that happening? And let's put thresholds there so we can at least catch that, as has already been said by the previous questioner. Dr. Agarwal, would you be able to help me understand why this still has not been put into place?
Sure. We do have models. So we have the fraud prevention system, which is a predictive analytics system that allows us to look at claims in real time. One of the models in that system does look at the type of spike billing that you are talking about, essentially significant changes in billing behavior in a relatively brief period of time. We also have other models that look at just the absolute dollars that are going out. So, some that look at the change and others that just look at high dollar amounts. We could perhaps work with the GAO to close that recommendation, but I do believe we have addressed it.
Well, if you have, I think it would be a great idea to work with GAO because it continues to show up in the recommendations. And if we go all the way back to 2007, we see this continue to be a recommendation that hasn't been closed. Then there is a question about why is that? A lot of money is spent with the GAO in trying to get these recommendations to you all, because understanding that you're very busy on administering the program. But I think when they are given, they need to be taken seriously, and we don't need to see them being open year after year. I want to go to just one other one, and I'm interested in the recommendation that was made by GAO regarding the home health agencies with known high rates of improper billing. The GAO recommended that the CMS conduct post-payment reviews, and that also seems to have not been done yet. Can you speak to that?
Yes, ma'am. So we receive regular reports from our zone program integrity contractors that conduct investigations against various providers that have, risen in priority. Each one of our zone program integrity contractors does conduct post-pay reviews of home health agencies in their zones. Again, this perhaps may be a recommendation that we could close. In specific, the committee is aware of the moratorium that we've implemented in home health services in a number of different geographies. As a result of those activities and other activities, as just one example, we have revoked over 100 home health agencies in just Miami alone in the last year. Half of them after the moratorium was put in place. So home health care is something that we are closely looking at. We, in fact, do conduct post-pay audits and payment suspensions and prepay reviews just in alignment with our other authorities. So I'd be happy to work with them to perhaps close that recommendation. Just
an observation that you did talk about several of these recommendations that you all are trying to address. I think that since you're fairly new with the organization, the agency, that it might be a good change in culture to go back and look at these and be able to report back to this committee in particular, but to Congress in general, to let them know that you are taking these recommendations seriously, because, as I say, there is a lot of money that goes into researching these recommendations and giving them to CMS, and I would hope that we would have you close those out. If you're really doing these, let us know, and let us know also how much has been saved. If you can help us to know that, that's very helpful. Thank you, Mr. Chairman.